So yesterday class, going back a little bit, we were discussing the rights of minors and what rights minors have in regards to um, receiving health care. And you had an assignment in 1.6 that was centered around knowing the rights of minors. So we're going to move forward here. And the subtopic we're going to jump into is preventative health care. What is that? By definition, it is medical care that seeks to prevent health conditions from developing in the first place. And one thing I can definitely say about a lot of statistics regarding African American males, we often wait too late and try to be too tough. Uh, and we wait too late to go to the doctor when the things are developing, which makes it worse and harder to treat. So preventative health care includes annual physicals. So athletes are not the only people in this world that need a physical every year. All people need physicals, okay? Wellness exams, especially for women, pap smears, mammograms, things of that nature. You need to get those done. Regular checkups. Vaccinations are definitely suggested, and other screenings as you start to become older are going to be recommended by your age and very important. Let's move on here to the next slide. You guys that I just let in that came in a little late, make sure you stay on after we get done so I can make sure your attendance is right. So this next slide is about the use your skills, making the most of your doctor's visit. So it says, what you want to do is write a list of questions in case you get nervous or forgetful that you want to ask your doctor during the appointment. Begin by telling the doctor any symptoms that you have that have been bothering you, okay? And for how long those symptoms have been bothering you. Ask questions about any medications, especially those that are prescribed that you have to get from the pharmacist, okay? Any, when it says when can you expect to feel better? That's a question that you can ask, and your doctor can give you a guesstimation. The next one says, how can you best protect your health going forward? Those things are things that you definitely need to ask your doctor. And then as you are in your own quiet space, you want to think of things that might be specific to your specific case and why you're at the doctor. We'll move forward here. So the next slide here, it says use your skills seeking treatment for a health condition. So remember, as we move forward, make sure you're getting the information that's underlined especially. It says recognize when you need routine doctor's visit or emergency care. Those are two different things. It says see a doctor if you experience symptoms of common diseases. Okay. So things like the flu, things that are not going away quickly, a rash that's been there for seemingly too long, if you're seeing any type of discharge or pus, these are things that you need to go to the doctor for. The next one, on the last bullet here, it says seek emergency care for what? Life-threatening symptoms and conditions. Things that are, for example, stopping you from breathing, okay? Things that will stop you from being able to live. This next one here, these are just asking you some critical thinking. It says, seeking medical attention. It says, for which symptoms of common diseases should you see your doctor? All right. So Things like basically things that stop you, impair you, or make you feel pain where you can't go through your regular, normal, everyday life and routine. You need to visit a doctor. What conditions and symptoms require emergency care? Something that's probably going to, if you suspect that it could possibly lead to death, you need to go to the emergency room and get there quick. So the last couple of questions kind of talk about things we've covered in 1.6. So things you may see on a test. What kind of physician provides routine checkups, screenings, treatments, prescriptions, and preventative health services? That would be your primary care physician, or PCP. When we went over it in class, I just said your regular doctor in our common language. The next one says, which type of insurance plan allows more flexibility in choosing healthcare providers, but is a little more expensive? That would be the PPO, Preferred Provider Organization. Stop. All right. The last one here. What determines minors' rights to access health care? That would be the state laws, depending on the state that you're in. And the assignment that we had earlier, that's what that pertains to. Okay. So it's one thing I want to show you guys real quick. I'm going to take this down. There's a video I want to show you guys. It is, I believe, right here. And it's just discussing how to prepare yourself for a doctor's visit the best way.
The most of your doctor visit. Being able to talk with your doctor is important, especially if you have health problems or concerns. Use these tips to make the most of your doctor visit. Prepare for your visit. Be ready to ask 3 or 4 questions. Share your symptoms, medicines or vitamins, health habits, and any major life changes. Take notes or ask for written materials. Don't be afraid to ask the doctor to repeat or clarify important information. Make decisions with your doctor that meet your needs. Discuss risks, benefits, and costs of tests and treatments. Ask about other options and preventive things you can do. Be sure you're getting the message. If you have trouble hearing, ask your doctor to face you when talking and to speak louder and more clearly. Tell the doctor if you feel rushed, worried, or uncomfortable. You can offer to return for a second visit or follow-up by phone or email. Learn more about communicating with your doctor. Visit www.nia.nih.
So we'll stop here. I'm going to stop my